This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Okay, we can see your screen. Perfect. Thank you.
So once again, I'm Josna, this is CN. We'll definitely have our email addresses at the end, and we'll try and run through it pretty quickly so we have some time for questions, but we are representing our PM&R program here at Stanford. So one big thing to know about our program, we actually have several rotation sites. So we kind of divide our time between Stanford Healthcare System, which is going to be both the inpatient hospital and then our outpatient clinics. We do our neuro rehab based at Santa Clara Valley Medical Center, which is our county hospital, and then spend a lot of time at VA Palo Alto. So we have 3 different sites, just something to take note of when you are looking at programs, because sometimes there's standalone hospitals, sometimes there's programs are at different sites. So that's one thing just to note about us. So at Stanford, we have really nice facilities. I'm currently doing my consult rotation at the main hospital, and we just see such a variety of patient population. We actually train at 2 separate level 1 trauma centers. So one thing that's kind of unique about us is we actually get to kind of make an impact on patients kind of pretty soon after any type of like traumatic injury or stroke or that type of thing. So they actually value us quite a bit in the ICU, and we're able to make some recommendations. And we, like I said, I mean, it is the Bay Area. We see a huge different amount of population. So we have different types of languages. We have in-person interpreters, and then also kind of virtual. So any language we're able to kind of take care of. And then we spend a majority of our outpatient experience in Redwood City. And so this is where we'll do our like sport and spine, kind of primarily our experience there. We also have unique referrals. We are exposed to a bunch of different procedural experiences. Our mentors and our attendings are leaders in both sport and spine, and have developed several protocols for some of the interventional spine procedures. And so great mentors to learn from. And then in terms of the procedures we do our fluoroscopy procedures here. We also do our ultrasound, we do BMAC, PRP, and then EMGs, of course. So that we spend a good amount of time here, mainly during our 3rd and 4th year, but actually we just made a change in our program to where P2Y2, you're going to get earlier exposure to sport and spine in case you are interested in potentially doing a fellowship in outpatient. And then Santa Clara Valley Medical Center is where we do primarily our neuro rehab. So we actually have a dedicated spinal cord injury service as well as a brain injury service, brain injury and stroke. So I have kind of friends in PM&R like across the nation, and I do feel we see a little bit on the higher end of more acute spinal cord injury and then higher level. So we definitely see patients, like I said, this is also another level 1 trauma center. So patients aren't actually just coming from California, sometimes Hawaii, Utah, like the neighboring states, and also treat kind of a huge variety of different patients. These are just some pictures from Valley. Our patients have a great time. We have aquatic therapy for them. We do exoskeleton for SCI and stroke, and then have service animals available. And then another site that we spend a lot of time at is the VA Palo Alto. Our VA system is one of the few polytrauma rehab centers in the country, actually. So, and for spinal cord injury as well. So we love our training at the VA. I have been a part of like a VA system since med school. I think there's a lot of benefit from having some of your training at a VA center. A lot of resources, and the patient population is just great. We do a kind of a variety of our rotations here. So as a 2, you'll do general MSK clinic as well as the spinal cord injury rotation at VA. So you actually get exposure both to Valley spinal cord injury and then VA, which actually is a pretty different population. So it's good to see kind of both. And then we have a polytrauma dedicated service, which we'll do as a PGY2 and a PGY4, and then general MSK and EMGs, as well as exposure to our amputee clinic. And we treat patients from literally everywhere. So some patients are overseas and unfortunately have gotten injured in the service. So we see patients from all of them. And it's really, really rewarding helping to care for them. So this is just a map of kind of where our main sites are. Just wanted to include this so you all are aware that there will be some driving involved. Most of the residents live kind of central, but we kind of have residents like anywhere from Palo Alto to San Jose. The commute would be anywhere from like 15 to 50 minutes, like on a bad day, like 5 o'clock traffic. And it is important to note too that sometimes our pediatric rotation is actually in Oakland, which is like about a 15-minute drive. And then Emeryville, sometimes residents choose to go there because we just have awesome attendings out there for both sport and spine, and we get a lot of procedural experience. So residents happily drive up to Emeryville, but just something to note. And then just kind of another drawing of where our sites are. So this is a sample resident schedule, and this is kind of always evolving. Like I said, we just made a change to our PGY2 rotation so that they actually get more spine exposure early on. All of our rotations, we have 7 blocks, and they are 7 to 8 week blocks. So they're a little bit longer, but kind of get most of the inpatient services are going to be early on as a PGY2, and then as a PGY4, you'll do a little bit more outpatient. And then the one inpatient service that you're on, you're primarily taking the role as the attending, so you have a lot of autonomy. So call, like you guys probably know, there's different call systems. We take home call here, and we have 2 different call pools. So one will be our county hospitals, so that's Santa Clara Valley, and then the other call pool involves VA and Stanford. At the VA, you're really rarely getting called. At Valley, it is a little bit of a different situation. It varies. I mean, it definitely still is home call, but residents do go in every so often because like we do take care of pretty acute patients. So if you are like medicine minded, I feel like our program is great for that because we actually do a lot of medicine on our neuro rehab rotations. Our call frequency, like the program before, they take a call a week at a time. We don't do that. We kind of split it up. So on average, it's like 1 weekend per month, 1 weekday per week. And then as you kind of progress through the residency, it's less call as a senior. So probably like you'll be taking 1 to 2 weekends per month as a PGY2, but now Sienna and I are PGY4s, and we actually are only on call like 5 weekends the whole year. So, and 4 of them are at the VA, which is not bad. So just our leadership, Dr. Smook is our chair of the department. He is an awesome mentor, very knowledgeable. He was the president of SIS and has published over 130 publications. And then our program director, Dr. Levin, also is spine, and he is our interventional spine fellowship director as well. Participates in a lot of research. He's super approachable, helps with career development, our resumes. So we have awesome leadership here. Highlighting some of our Stanford attendings, Dr. Rowe, he's like an ultrasound guru, does a lot of our ultrasound didactics, and we do procedures with him. He's a team physician for the US. He just went to, where did he go? Korea?
Oh, Dr. Fred went to this past Olympics.
Well, Dr.
He
Fred,
went to Korea, which
yeah.
is the one before, the winner.
Dr. Rowe went to Korea for the Winter Olympics. Dr. Fred actually just went for this past Olympics. Dr. Stanek is a relatively new addition to our faculty. He's awesome. Residents are like fighting to work with him because he is just great at ultrasound, and he actually has a interest in performing arts medicine. And then Dr. Kraus, she does a lot of work in our motion and sports performance lab, and she's a pediatric sports medicine doctor who also does a lot for our didactics too. And all of these attendings are really approachable, and there's just a lot to learn from them all. Our Palo Alto attendings, also great. Dr. Karandikar, he's actually orthopedic trained in India and then came and did PM&R here. One of our favorite lecturers. He actually was our most recent spine fellow, just to incorporate spine into his practice, but he just took a job at UCSF, but he loves working with residents so much that he's actually still going to be at the VA doing ultrasound injections with us 1.5 days a week. So we're grateful for that. And then Dr. Terioka is the site director for the VA Palo Alto. He has a special interest in acupuncture. So we actually do acupuncture with him on Monday mornings when we're on the VA. And then Dr. Oda is our SCI fellowship director, and all of them very approachable. Our Valley attendings, Dr. Crew is the PM&R chair. He's SCI fellowship trained. Dr. Hoy is our brain injury chief, also fellowship trained. And then Dr. Varma is a brain injury attending. She's boarded in brain injury. And we have a really unique experience by working with Dr. McKenna, who is actually medicine critical care trained, but he has a special interest in spinal cord injury, and he has his own respiratory rehab unit, which is technically not acute rehab. It's for patients who like acute spinal cord injuries who are still on the vent, and like we participate in like vent weaning trials. So that was something I didn't know when we came here, but it's been a huge value to our training, and like a really good job like training point. And so I'm on consults right now. I'm being consulted on some acute spinal cord injury patients, and I just called Dr. McKenna about like diaphragm pacing because I didn't have too much knowledge on that, and he sat on the phone with me for like 30 minutes and just talked to me about it. So everyone's really approachable here.
Yeah. All right. What do we got?
You got 7 minutes.
7 minutes. All right. The residents left. That's our annual Christmas party. So we're under the ortho department, and the chair of ortho throws this massive Christmas party every year. It's great. Open bar. He's got great taste in wine. Middle picture is us on resident retreat day. It's usually the PGY2s. We make them plan our whole day. And this year we went kayaking, saw some otters, and then had a really intense battle on the beach. Each class competed with different games, and unfortunately the PGY4s won. And then that's us on the right. We just had a July 4th barbecue welcoming our new PGY2s to our program. Tons of research opportunities. Pretty much at any given time, you can ask any attending and they'll have a project for you. This is an example of some of our current projects that we're working on. And every year we do a research day where we present what we've been working on to each other and our faculty. We have lots of experience with ultrasound. At the VA, the attendings there do like one-on-one training with you, and we do a lot of practice on each other. In the middle, we have a free clinic we run once a month called Arbor Clinic, and we basically treat patients that are uninsured over on our Stanford campus. And on the right, tons of sports coverage. We work really closely with our sports fellow, and so any given time they're doing tons of sports coverage. You can go to a lot of the games and watch them. We also teach a class. Me and Josta are regulars. We teach it every year. It's like a MSK class to the Stanford undergrad students.
So it's like undergrad, PA students. Yeah, so it's
super
a fun time.
And then there's an opportunity here called biodesign. They basically take MDs, engineers, and business majors. You pair them together and you come up with a project. If it gets accepted, you get funding and you can actually market the product. No one in our class did it, but the class above, 2 people did it. And if you've ever used something called the Zeo Patch, that's one of the things that came out of this project over at Stanford. Elective time, we get basically 4 weeks, and if you do well on the SAEs, you get 2 additional weeks, so 6 weeks total. And you can do a lot of local electives. You can do some away electives, and international. 2 classes above us, someone went to Japan. Just some places where we end up. A lot of us stay in California, but we're all spread across the country. For example, the class above us, 3 of them did pain. They matched their top choice. 2 of them went straight into work. They're both in the Bay, so they stayed in the Bay. And then 1 did peds, and then 1 did sports. Yep. Of course, it's expensive to stay in the Bay. We're compensated accordingly. We get tons of random stipends. So the number that you see on the left is not including our stipends. So you'll get paid more.
Yeah. So for this, like this obviously changes every year with inflation, but as a PGY2, it's around 75,000. But with all of the stipends, you get like a $4,000 moving stipend. You get a stipend to have a cell phone. So like it ends up being like 81,000.
You get paid like $600 a month for a living. And Bay's awesome. There's like a train that connects us to the Bay. So it's called the Caltrain, and you can drink on it randomly. So go on the Caltrain, you go into the city. Super fun. Just beach close by, the mountains. A bunch of us got ski passes this season, so we're planning on spending a lot of time in Lake Tahoe, Napa, wine country. There's wine tasting super near us, like 15-20 minutes, and then there's Napa and Sonoma a little bit further, like 1.5 hours. And then give us a follow on Instagram. Yeah, we're active. We love intramurals. There's like the Stanford intramurals. Last year we won 3 of the intramurals: pickleball, volleyball, and soccer. And then
yeah, these are just pictures from us. We like I think PM&R in general, you'll kind of notice everyone is like the same mindset, super friendly, like team players, but we definitely like spend a lot of time together. And we are one of the bigger programs. So we have 7 residents every year, as well as several fellows. So 3 sports fellows, a spine fellow, and then this year 2
spine fellows. Oh yeah,
2 SCI fellows. So we actually spend a lot of time with our fellows too. So it's a good time.
I'd like to skip that. Our contact info. What's the time? Do we have any time for questions?
So. Great. We have 2 minutes left to answer any questions.
Sorry, guys. We had a lot of info.
Is that to us?
If there was one thing you wish every applicant knew about your program, what would it be? I think for us, like one thing I want to get out there is that there's just a lot of opportunity being at Stanford, and like any interest that you have, like there's a way to kind of like foster that. And our attendings are really, they all have their kind of little niche interest and willing to take you on if you're ready to, if you want to kind of follow in their footsteps or kind of carve your own path. So, I mean, there's just a lot of opportunities. This program is definitely for someone who is also like self-motivated too. And like, we're definitely looking for people who love the field and like kind of want to contribute to it and kind of take advantage of the opportunities. So that's probably what I would say.
Yeah, you can even take Stanford classes like at night. Night classes if you wanted on campus. Anything else?
I had a question.
Yeah, what's up?
Hi, my name is Jackson. I'm a 4th year from PCOM. Thanks for the presentation. I just wanted to ask with the electives, is there any opportunity to work with like concussion patients, mild traumatic brain injury? Thanks very much.
Oh,
Yeah.
I mean,
so Dr. Kraus will see a lot of concussion patients, and then even at the VA, but like any interest that you have. So we actually have a resident our year who is going into headache, like, or applying for a headache for fellowship. So she's spending time with the neurology department. We have a patient, one of our residents who has a special interest in pain, but like kind of like hypnosis and like kind of other modalities. So she's kind of created her own elective. So our electives are very flexible. I did a spine elective and kind of handpicked the people I wanted to work with, and it was really easy to do.
And you'll see tons of concussion
Yeah.
and TBI in clinic.
Yeah.
So you don't even have to do an elective to do it. You'll just see it like
Yeah.
all the time. Yeah.
And on the other end of the spectrum, we actually see a lot of disorders of consciousness too, which is one of our PGY4s went into brain injury, and that was kind of a special interest for her. And when she was just applying to other programs, she was telling me how that isn't a huge exposure elsewhere. So
it's called Journey to Recovery, and they, instead of like a 2 to 3 week rehab stay, they have like months of rehab stay, like months. And so we take them from like Rancho to and bring them all the way to wherever they get to, but pretty low level.
Yeah, not to take up more time, but I'm lucky enough. I'm at Baylor right now, and they said it's not as widely used everywhere, the disorders of consciousness, but it's pretty awesome stuff. So that's good to hear you.
Awesome. Yeah. Who did we have? We had someone go to Baylor a couple years ago.
Oh, as a resident?
Yeah, they're
Oh,
also awesome
cool.
for neuro rehab.
Yeah. Any other questions?
Oh, sorry. Feel free. Like, I get a lot of emails just from interested med students, people even just if they're not even like trying to choose between PM&R and other specialties. So both of us are happy to contact or be in touch with you all via phone or email or whatever. So definitely resources and use us.
Well, thank you so much to all our presenters. And just as a reminder, our next virtual residency fair will be in 2 days from now. That's on the 14th, this Thursday. It starts at 8:05 Eastern Standard Time. Thanks again to everyone. Thank you so much, Stanford. It was a really wonderful presentation, and have a great night, everyone.
Thank you. I'm just putting our emails in the chat in case that's saved and recorded. So, yeah. All right. Have a good night. Sorry it's late.